Hi everyone, my name is Dr. Suruchi Thakore. I'm one of the physicians here at IVF Michigan and Ohio Fertility Centers. I'm going to be talking to you today about the all-important semen analysis. Now, as we know, when we're doing the initial workup for infertility and people having trouble getting pregnant, a semen analysis is a very critical part of it, since sperm is 50% of the equation. So when we do a semen analysis, we're looking at a few critical parameters. All of the cutoffs that have been created were done by statistics and recent studies and past studies that then help us determine what is the number needed to be able to achieve a pregnancy, or what is the number seen in people who get pregnant easily. And that's kind of important to know. These are just cutoffs that were created to be able to say, yeah, it's more likely you're going to get pregnant as long as everything looks good. Okay, so when we're evaluating the sperm, there's 3 criteria. These criteria have been set by the World Health Organization. Okay, we look at the concentration, which is how much sperm is in each milliliter of ejaculate. The movement, how are they moving? And this can be broken up into total motility and progressive motility. Progressive motility is the good movement, the one that's moving in the right direction, okay? And then we look at the shape of the sperm. So the shape of the sperm tells us, yep, at least it's got all of the criteria that's necessary, the shape necessary to be able to penetrate the egg and help with fertilization, okay? So before we go into what the different cutoffs for each one of these are, I like to tell people and explain to guys that sperm is a vehicle. It takes the DNA, which theoretically is perfectly normal, and moves it from point A to point B. So if you have a car that maybe has some deficits, like its tires don't work properly and doesn't move, or its engine kind of comes in and out, or the shape of the car is falling apart, it may not get you from point A to point B. And that's the reason why we need to figure out if all of these components are there to help us create a pregnancy. Okay, so that being said, what are our cutoffs? So when we look at the different things that are important in a semen analysis, we talk about concentration, right? How much sperm is actually in that sample? About, I wouldn't say like a 10th to 15th amount of the sperm that's actually ejaculated into the vagina gets to the uterus where it's actually supposed to go, okay? So that's really important to know. Though we have a large quantity at the beginning, not as much gets filtered through the cervix, and then not even more, less than that gets to the actual uterus. So that's important to know, okay? So the concentration cutoff that we use is 15 million sperm per milliliter, all right? When we talk about the motility or movement of the sperm, we want the total motility to be at least 40% or higher, meaning at least 40% of the total sample is moving in a direction that's considered normal, okay? Progressive motility is the good movement, the ones that are going kind of from point A to point B, not going around in circles or going off to the side, those type of things, okay? So progressive motility, we want at least 32% of the sperm that's moving to be good moving sperm. The last parameter is morphology. So this is the shape of the sperm. Sperm has to have a specific shape to the head, to the body, and to the tail. You can have 2 heads, you can have a round head instead of a triangle shaped head, you can have 2 tails. There's lots of different versions of sperm out there, and I'm sure you could look those up online to see what they all look like. But we want 1 head that has a cone shape to it, we want a nice thin body, and we want 1 tail that's moving well. So that's a normal shaped sperm. So we're really strict about how this looks, and so we only need 4% of a total sample to be looking normal and be considered normal, right? So it's not a high standard to be set, but even then, sometimes we don't meet that standard either. So that's the summation of a semen analysis and kind of how we break it down. But again, in total, what's most important is when you mix it all together. Okay, so now taking the concentration, taking the movement, and putting that together and saying, do I have enough moving sperm to be able to achieve a pregnancy? This is where we then decide what treatment options are going to be the best for you based on the quantity of sperm and the movement of the sperm that we have. I hope this helps explain things a little bit. Please let me know if there's any other questions and we'll start another video. Thanks, bye.